Hello, my name is Paul Gilbert, and I'm delighted and honored to be able to tell you about two wonderful speakers we have coming to our international conference this year. This is the Transforming Minds Through Compassion conference in Birmingham on the 6th to the 9th of October. So our speakers are going to be Dr. Patricia Gerbarg, who is an associate professor in psychiatry at New York Medical School, and also Dr. Richard Brown, is an associate clinical professor of psychiatry at Columbia University, specializing in psychobiology, psychopharmacology, and integrative psychiatry. Now, between them over many years, they have had substantial publications, academic papers, and books, such as Non-Drug Treatments for ADHD, The Healing Power of the Breath, and How to Use Herbs, Nutrients, the Use of Yoga in Mental Health. Over many, many years, they have been active at the forefront of using body-based practices to address trauma, and they've gone all over the world to major trauma areas, helping people who have been caught up in the tsunami, helping people caught up in numerous wars in Nigeria and Rwanda, and working with groups on a large scale, large numbers of people, helping them to use the breath and body-based experiences to work with their trauma. It's quite extraordinary, amazing work. So it's a real privilege and an honor. And I should say that I learned a lot of my breathing practices that we've introduced into compassion focused therapy when I attended one of their workshops in New York many years ago. So Pat and Richard, could you tell us a little bit about what you're going to be talking to us about for your keynote in the conference in October?
So thank you, Paul. It was a special experience the first time we met. And I just felt that we were thinking along the same lines in terms of, wanting to change how people are in the world these days. And things have only become more stressed. So we empower people to be the best they can be by giving them the tools to change their internal software, which means changing how your autonomic system is working and making each part of it work at its best. And it ends up being so much simpler than other approaches. And it's been fascinating for me working with many groups around the world, different bureaucracies. After people see the results, they often come to me and they go, "Don't get me wrong, doc, but it's great that this is so simple." And it often obviates the need for more in-depth treatments. And just making people feel that they have control over their reactions. They can make their brain work better. They can make their relationships better. They can be more loving and connected to people and the earth. Seeing that happen, and it's been an evolution for us over time. Certainly working with researchers in Canada there, and they encouraged me to bring together techniques from all over the world. And we've worked hard together and with our many teachers around the world to refine our approaches. We've learned from every country we go to. And so what we're doing is still evolving, but just seeing the results, whether it's in Ukraine or Rwanda or South Sudan or Myanmar or Brazil or many other places around the world, it's the most gratifying thing I've done in my life. And it's brought together all the different threads. And it also means that instead of it taking 10 or 20 years before you learn more advanced techniques, we feel that, or I feel that, our minds are so disturbed and we've so hurt each other and the world that we need to put things back in balance again. And to see it happening in a short time. And I would say at the core of us is an awareness and a lovingness that this brings out. And seeing that spread is just wonderful.
Thank you so much. And one of the amazing things that you say, and I certainly experience this, is this immense integrative approach that you have, as you say, learning things from all over the world, putting together the integrative approach, the alternative medicine approach, complementary medicine approach is just amazing. So, Patricia, did you want to add anything to that?
Well, we always try to do a combination of explaining didactic explaining of some of the things we've learned about how the breathing practices affect our mind, our emotions, and our relationships. We share that. And we also want to share with people the actual practices. So we do both. We have didactic teaching about some of our research projects and examples from some of the places where we spent a lot of time providing treatment for people who are extremely traumatized. And then in addition, people are able to follow Dr. Brown, Richard, I should say, is my husband after all, follow my husband, who will lead you and guide you to actually experience some of the practices and get a taste of what it feels like when you can shift your whole system into a better place, into a less threatened, feeling safe, and being more able to bond compassionately with people, connect with people. And I talk about some of the science of how those connections might be working. So it kind of satisfies both the mind and the body in a way. So it's a lot of fun. And we've really have a lot to bring to you, especially our work in places like Ukraine, where we've trained hundreds of mental health professionals who have gone out into their communities, both helping adults and especially children, which is our main concern always when you have this kind of trauma. And one of the messages we're able to bring them is that we have found over the years that it doesn't matter how extreme the trauma, and it doesn't matter how many years have passed, people can still respond and get into a healing process with the help of these breathing practices. So we're absolutely delighted to reconnect with you and have a chance to share this with our friends abroad.
That's fantastic. So everybody, if you're watching this, if you want to learn how to help the body support the mind, this Patricia and Richard are world leaders. You're not going to hear it from anyone better. So we are just honored and delighted that you're going to be with us in October, and we look forward to seeing you there.
Thank you so much. We'll see you soon.
Thanks.
Bye-bye.
Bye-bye.